The committee of the whole is in order, but we will be going back in recess because we're waiting for the Director of Public Health as well as a representative from the fiscal team to arrive to be able to have the senators to ask questions. We are in recess. The Committee of the Whole is back in order. So we have the fiscal team here, and so we just await the arrival of the Director of Public Health, Ms. Teresa Ariola. So we'll be in recess for a little bit longer. Thank you. We're in recess. The committee hall is back in order. Thank you, Director Ayola. And also, colleagues, we have a couple of other guests that are joining us on the program side. They have been sworn in, and so I'm going to go ahead and have them introduce themselves. Pull the mic a little closer to you, ma'am, please.
Thank you, Senator, and thank you to everyone here today. My name is Irish Davis. I'm a program coordinator with the Bureau of Child Care Services under the Division of Children's Wellness and Public Health.
Thank you. Thank you. And just a moment, Miss Irish, I believe, was the one who was on the conference. So if you have questions about what may have taken place on the conference and any news updates, colleagues, you might want to, you have an opportunity to ask Irish now that she's here with us. Next, ma'am, please introduce yourself.
Good morning. My name is Regina Mofnis. I'm a program coordinator with the Division of Children's Wellness State Office.
Thank you, Regina. And also, we'll just remind all the panel members that we are still under oath, and I will now recognize the speaker. You have some time left before we recess. Mr. Speaker.
Thank you very much. And Irish, thank you very much for being here. I guess the million-dollar question is, okay, so what's the news?
Thank you for the question, Senator. So the whole premise of the STAM, the State Territory Administrators Meeting, is to gather all of the state and territories by the Office of Child Care. And so this is an opportunity for all lead agencies, such as ours, to share with our peers with other states. Of course, the biggest question is, what are the updates? Updates that were given to us besides this final rule of the CCDF ruling is that we're all now gearing towards for the timeline of the CCDF, the Child Care Development Fund Program state plan updating, because we will now start our draft updating this coming fall.
What does that entail?
So the CCDF state plan basically entails what each lead agency will as far as program administration for the CCDF programs.
Anything about what the funding levels will be?
We did bring up the funding allotments. Because there were different sessions, during the regional sessions, we brought up if there's any more opportunities for funding, and unfortunately they only said if we had to seek alternative routes like supplemental grants and other sources.
So what can we assume what our funding level will be for next year, next fiscal year? What can we assume the funding level will be for next fiscal year?
It would look the same, sir.
Which is, and what is that?
$22 million.
$22 million.
Yes, sir.
Okay, I'm going to get back to that question later, okay? When we last left, I was going over some math. And basically the need for this fiscal year is roughly around $29 million to end this fiscal year. And, taking into account the number of children that you have in the system, which is 2,700, that basically comes out to about $895 a month per child. Okay? That's just a rough. Then we go ahead and we extrapolate what you need for your salaries, your training, and whatnot, okay? And depending on the scenario, it comes up to anywhere from $3,778,000 up to $6,285,000 in funding that I don't know where it goes. Okay? And that was the question that I left with, is of the funding that you're asking for and the funding that you need, there's still a delta of in excess of $3 million up to $6 million, depending on which formula you use. The $3 million is based on if you to assume that each family gets a $700 subsidy per child. And the $6 million is based on an average okay, of your subsidies, and with a delta. And so I'm looking to you guys, you folks, give us a breakdown of $29 million.
So the breakdown of the 29 million, I think it was already mentioned that the minimum is 70%, but we've been operating at 90% for the subsidies, and then and yes. Okay, so it was 25 million for the subsidy expense, and personnel and operations are at 3.4.
And that's what I'm getting. But I'm still, if you do the math, you still don't account for at least $3 million.
Mr. Speaker,
Sure.
if I can add, 29,168,026.86 is the total program total expenses. Subsidy expenses at 25,683,026, and personnel and operations, which includes training for direct service staff as well as salaries, at 3.485, which equals 29,168 that we need for the entire year to operate the CCDF program. So that includes subsidies, salaries, training, based on the program allocation of 95%, or I'm sorry, based on the program allocation. So that's you wanted the breakdown. Subsidy expenses, again, 25,683,026.86. Personnel and operation is 3.485 straight. That gives you a total program expense for the year of 29,168,026.86.
Give me your subsidy total again.
25,683,026.86.
Okay. Ma'am, I'm just doing some simple math here. At
Is my math
your,
wrong, ladies?
okay, your high-end subsidy at $700 a child, multiply that by 2,700, then multiply that by 12, only comes up to $22,680,000.
So, Senator, earlier in the year, we were paying at 100% for all child care providers. We did not pay the max. The max right now is $700.
Yes.
But that was only effective in January. So the first quarter, because we were still in the realm of COVID and sustaining the child care programs and businesses, we were paying it 100%. So you could have one child care provider charging $4,000 for one child, and for that same child at the same age at another daycare, they're charging $800. So at that time, when we had all these excess funds, we were still paying it 100%. We were also paying at full enrollment, so we weren't even paying part-time. So that's part of the story, and that's also part of the increase of subsidies at the time. So that's why there is a rollback as of January to pay the max payment only of $700.
Didn't we anticipate that that funding that you were using was going to run out? And what are we going to do after that?
Correct. And do you want
to? Once again, as I stated last week, we were not aware of how much money we're going to get. This grant does not put out in the beginning of the fiscal year a total max. We saw that the allotments were slowing down, so we needed to do something in case something dramatic or even a cut compared to last year. I kept asking the staff, did we get any formal notification that we're going to get cut? just assuming we're going to get the same amount as last year. And everything is an assumption, unfortunately, senators, because unlike other grants, again, we do not get an announcement, we do not get a full allotment or a notice of award that says, for this year, we're going to get 22 million. So either way, I would have had to come down, whether it's through, again, the governor's bill or through a supplemental bill by a senator or going through my legislative oversight, I would have had to come to the legislature. So, I mean, that's the best I can explain it.
Mr. Speaker, if you need some extra time,
Yes,
I'll
please,
yield
I
my-
do.
I'm yielding my time to the Speaker. Please note that, timekeeper.
Thank you very much, Mr. Chair. You have a breakdown as to what your expense was, starting with, let's start with fiscal year 2022. What were your-
22?
Yeah,
Okay, we
every
don't
year
have that.
since then.
We don't have that. We're going to need to get total expenses for FY22. Is that your question, Mr. Speaker?
Every year. What were your
From what
costs?
year?
From FY 2022.
Okay, we'll
Through-
work
through
on, the staff
2026.
can work on that. Can you? We're getting that
Thank
for you.
Okay, I'll wait. Give me a
We'll go
recess,
in
please.
recess for a moment. Committee of the Whole is back in order, so Public Health, you're recognized.
My apologies, Senators. Mr. Speaker, if I could just reiterate or clarify a few things, because I might have said a certain way that might have confused everyone. For FY26, our total program expenses to operate is $29 million. Of that, $25,683,000 is our anticipated expenses through September 31st, of which 7.6 are asked today to the legislature is built into that. So we need 7.6 from local appropriations to total our anticipated total expenses for this year of $25,683,000. Add to personnel and operations of 3.485, the total expense to operate and execute the program is 29,168. So again, our ask of the legislature for local subsidies for the first time is $7.6 million. The breakdown of that 7.6, once again, it's to pay for the remaining June invoices of 1.208, or we can round it up to 1.209. July, August, for June, that was for June, and July, August, September of an estimated high of 2.140, for a total of our ask today of the legislature for local appropriation for 7.630. That's rounded up. So I apologize if it was a little bit confusing, but the 25 million does include the 7.6 that I'm asking for. And now I'll turn it over to the staff, Mr. Speaker, and they can talk to you about the previous fiscal year's numbers that you asked for.
Okay, sorry that took a while. Our team at the office were gathering all the information. So in terms of the eligibility since 2022, that is the same eligibility as it is today for the income guidelines. So nothing changed in terms of the income bracket for households and family size. So for example, household of 2, the monthly income maximum was $5,225. That was in 2022 when we implemented under that program in Penilan, and till today it's still the same. There has been no change. So as to your second question, when you were asking about the total expenditures for FY22, so keep in mind this is inclusive of other grants that we were running at the same time. So I have a kind of a comprehensive amount of how much we spent for that fiscal year. So in fiscal year 2022, we spent $32 million. In fiscal year 2023, we spent $51 million. In fiscal year 2024, we spent $38.3 million. And in fiscal year 2025, we spent $45.29 million.
Okay. Now, when I compare that to the information provided to us in the budget digest, okay? This one, okay? In the back, there's a breakdown of the federal funds received. And just going across, your totals were $32 million for FY 2022, And what you received in 22 was $21.93 million. In 23, you spent $51 million, but you only had $22,474,570 in child care and development block grants. And you, first off, is there any cost share to any of your programs? Any cost share?
No, there's not. It's
So
100% federally
It's all
funded.
100% federally funded.
Yes.
Okay, in FY24, you spent about $33.3 million, yet you only received $22.09 million. In 25, you spent $45,029,000, but you only received $22,810,392. This is according to what was received. How do we pay for this?
So, Speaker, back to the first one, you said that when we were going back to FY22, which was the $32 million,
Right.
we also were running the CARES Act, which was in 2020, and our CURSA Act, which was also federal funding in 2020. And so all the funds we received actually all in 2020, they were all given. So these were all carryovers that got us through the years, because they were all extended up to FY20, up to 9/30/2025. So anything that we did not spend in a current year, we just rolled it over to the following years.
Okay. And it's my understanding that those grants expired
9/30/2025.
2025.
Yes.
Okay. Which brings me now to FY26, that right now your total that you need is $29 million. And according to this digest, you only anticipated receiving $13,896,095.
At the time,
What other grant did you use?
none.
Again, this is something that was given to us, okay, in February of this year, which shows that you were only expected to receive $13 million. As a matter of fact, you've only estimated, and I asked earlier, Irish, and you said you anticipate $22 million, but the estimated cost that you provide here is only $13 million. It's the same amount that you received in FY26. Where are we getting $22 million?
So, Mr. Speaker, at the time when that was prepared, that's all we received. And so that's the number that we provided BBMR, or it showed that we received. We received subsequent funds after that from CCDF for a total of 22, because it was very clear on the fourth and final NOA that we received in July that that's it. They made it very clear that we have received the total amount for the fiscal year in the July allotment. So when you add up everything we received from October, I know that your number is reflective of February or January, February, but then take into account everything else we've received, and then noting that our last allotment that were received by CCDF Federal was in July. It was 22. So we know we're not going to get any more than 22 this year. And so when we look at an anticipated expense of 25 through September, that's the variance that we're asking the legislature for at 7.6.
Okay. So this is, let's go back to the beginning then, okay? So this is not an $11.4 million ask, this is only a $7.6 million ask.
We require 7.6 this fiscal year to finish off and pay all the expenses for this fiscal year, 7.6 million.
and the 7.6 million only reflects the money necessary to pay the child care providers.
Correct.
All other expenses, training, administration, salaries,
That
they've
is
all
part
been
of personnel and operation.
That's already been accounted for?
Correct.
So you don't need any more money for that?
We've already, 7.6 is only subsidy expenses. It's part of the anticipated 25,683 anticipated subsidy expenses that will carry us through September 31st. We need 7.6 million, or asked, to pay for subsidy expenses.
Okay. But so my question quite simply is, you've already expensed out your salaries and your training.
That's correct. We put aside 3.485 for salaries and training for direct services. That's part of the regulation of the CCDF program in total. So
the bottom line is, if you don't get 7.6, you're still going to get paid.
yes, sir, because somebody needs to administer the program.
Understood. Understood. Okay.
Yeah.
I mean,
Yes.
you know,
Yeah, and that's part of the
unfortunately,
allocation.
it doesn't look. I'm sure it's not pleasing to the child care providers because they're waiting for their money to operate. They're waiting for their money to pay their bills.
Correct. 7.6 is needed for subsidy payments.
Oh. Sure, I don't think. Well, you know, there's. You know, I hate to say this, guys, but we're going to run into problems when we start to get to the other bills. And I you know, based on the rules of order, I'm not going to bring it up until it's brought up. But okay, anticipate that there's another bill that's coming up that's really going to be problematic. Thank you very much, Mr. Chair.
Thank you, Mr. Speaker. Senator Gumentauta, you're recognized.
Yes, thank you, Mr. Chair. Let me just, if I can, to go back to our conversation last week. Can DOA confirm, were you able to transfer the $1.8 million in CCDF funds to public health that was discussed last week?
Senator, I'm not really sure what you're referring to.
I mean, I just wanted, there was on the record, we're talking about a transfer of funds, 1.8 million. They're shaking their head over there. I'm just trying to see if that happened.
That's from the $5 million, right? That the
Correct.
governor transferred.
Correct. Yes, correct.
Ordered them to pay? Yeah.
Yes, correct.
From the $5 million, Ed.
Sorry, which 5 million?
So when the governor made the announcement and press release that she gave you $5 million to take care of this, last week you said that there was a $1.8 million balance.
I understand. Thank you, Senator. The 1.8 million was to pay for the balance of June, and I haven't had the submission from Public Health to do so.
Okay, so then I guess my second question of the status for payments for June invoices, that hasn't been done yet either.
The second half of June, or the balance of June, has not been submitted to DOA.
So then July payments are definitely not in play then?
Well, July payments, I think, is what the director is talking about, which would be included in the 7.6 million.
Okay, I'm just going to say for the record, can I ask, based on this, do Guam families pay no more than 7% of their median income toward child care co-payments as part of the CCDF program?
Senator, are you referencing the page that was passed out with the examples
Yes,
in the bottom?
the rate, yes. Do Guam families pay no more than 7% of their median income toward child care co-payments as part of the CCDF program?
Sorry, the question was if these are the maximum rates, Senator?
My question is, do Guam families under the grant pay no more than 7% of their median income toward child care co-payments as part of the CCDF program?
Yes, according to the current rates that we have, Senator.
So that means that, help us understand, 'cause you weren't here last week, but we were talking about the change based on the Federal Register. I mentioned to you the final rule back on March 1, 2024. It was published effective April 30, 2024. We're talking about there was a change in the cap. July 13, 2026 rescission, which is now the law. Again, if there's, let me go back. There was a report by HHS, 15 states and DC, they pay exactly at 7%, and 16 states plus 5 territories below 7%. So my question was, do our families pay no more than 7% of their median income toward child care co-payments?
So that is referencing the sliding scale, yes. So that's the $25 co-share. That's the max per child, and the max will be the $75. So no family pays over $75 for that.
Yes, thank you. Okay, again for the record, are you paying are you paying providers based on a child's enrollment rather than daily attendance in line with the federal rule changes?
As of now, we are paying as of enrollment. There are plans for possibly later on implementing based on attendance. But as of today, we are paying child care providers through, based on enrollment.
Is that affecting program participation?
Right now, the numbers are steady. We haven't had a decrease, a significant decrease. The decrease would be applicable to cases where the child is aged out from the daycare going to school.
So another question is, what direct services are covered under the CCDF, and are faith-based organizations who provide child care services a part of this, or are they being encouraged to participate as well?
So everyone is encouraged, first off, to apply for child care development funds to be a certified participant. So they just have to meet their criteria. So even faith-based, so they would have to meet the criteria, but it's not, I need to be clear that it's not a tuition that we pay. So if like going to a private school, we don't pay that tuition, we pay a subsidy for actual child care.
So are you guys doing outreach to them on a regular basis?
Yes, we actually have a unit that goes out there to recruit new child care facilities, to share the word about the positives of being part of child care. Because you do have a lot of child care facilities that are licensed by Guam, but not certified under CCDF to receive subsidy.
Right. Again, I'm looking at it from more of an equal access issue.
Right. So we do have a unit that goes out to try to encourage other child care facilities to be part of child care so that the families can avail of the subsidies.
Do we need a different approach to help working families with child care?
Well, there obviously is need on island for child care, but I want to remind everyone that Child Care Development Fund is for low-income families. It was never intended for essential workers or first-line responders, because it was for low-income families. So, and the priority was always for single parents who wanted to go to school or to work, or for children under foster care, or for homeless families, so that their children can get provided care and opportunity. So I think based on, everything comes down to a budget. If we're living within our means, then that would mean we would probably have less families in the system for child care subsidies. With the infusion of local assistance to support it, then more families can avail. So if that's something that the legislature is willing to do, that's how families can be helped.
I mean, I'm trying to look at maybe if there are any systemic gaps, because I don't think this appropriation is a one-time fix. This just can't possibly be a one-time fix for this entire program.
Well, I can tell you that I had a very interesting meeting with the child care providers yesterday, and just keeping things at is what we are asking for at 7.6, eligibility, the max, the everything. But they are seeking for the rates to be increased, and I think they're working those numbers out and working it with, I believe, Senator Montanani. It's still in the process. They're talking about it. So you're correct, Senator. It's not going to be the last appropriation. It's what we need. This 7.6 is what we're going to need to finish off the year and pay the subsidies. Next year, you received the governor's supplemental bill that will include roughly the same amount, because we're hoping and that we're going to get the same 22 million. And so in the substitute budget bill, FY27, the governor has added that. And so, and that is just to keep things the way it is today. No increase, no changes, no, not adding any more children. If we add more children, then that figure is going to change. That amount asked is going to change in the near future. But if we keep it at 2730, then it's going to be okay for next fiscal year. If the legislature wants to increase the rate, then that's going to, obviously, we're going to need more funding than more than 7.6.
No, and I guess why I'm asking this question specifically is this is not the venue that we're going to have to try to fix this entire issue facing the grant and what we do to administer the program. It's going to, I mean, are there facility capacity issues, wait list size, we're talking about the federal rule, and it's like it's cutting off, and we're trying to figure out what to do when it's over, and the volatility of it. That's why I'm asking. This is not probably the venue for it. I know we're here for an appropriation, but I'm hoping that there is a conversation that could lead to a much more important policy change to this. I only have a couple more minutes, but I only have one more question, but might take a bit on this. But should we pursue options to support this industry that address our unique needs? We heard from Gita last week that this is not a sustainable thing down the road. I mean, I appreciate the candor and the acknowledgement, but should we pursue options to support the industry that addresses maybe our unique needs in Guam? I know this is different than Maine, than in New Jersey, in Hawaii.
Absolutely. If we want to keep working families working and getting their kids watched, we're going to need to be able to find other areas, if not local appropriation, then what other means so that we can increase the number of children and families if we wanted to. So, of course, we should always look for other areas or revenue streams that will allow us to pay for childcare. When those opportunities come, we're definitely going to apply for it, as long as it's allowable to pay for child subsidy, child daycare. We'll definitely go for it. And like previous grants, like CARES grants and other grants that we have used in the past that have now expired, we'll do the same.
And that goes back to, Mr. Chair, when I started this last week, when we think about the dependence of the Guam program on a single very volatile federal funding stream. 2 conflicting federal rule changes that happened for this program in a span of 26 months. It was the question that I had. I wasn't here in 2024, but I brought forward the fact that we've kind of known about this for a little bit. And I'm hoping that after the conversation today, Mr. Chair, that we're able to come back and look at some type of solution that obviously that we all can get behind. And I know that I hope it doesn't hinge on federal rule changes. It needs to be an honest discussion about what we see for this industry moving forward, especially so we don't have to come back at either supplementals or mid-year type of bailouts when the reality is that we just need to find a better solution to address this need. Mr. Chair, that's all my questions, and thank you, Public Health, for your answers today. Thank you.
Senator Gumatauta. Once again, folks, we are here a week later, and as just testified to, there's still not reconciliation of invoices. There still hasn't been a submission of the $1.8 million for June. So this is not an appropriation issue right now. There's money in the bank, and they're still reconciling June. We're talking about July forward right now. Senator Barnett, you're recognized.
Sidus Masi, Mr. Chair, Manana Sidus to the people of Guam watching on our YouTube channel, and welcome back to the panel. I just wanted to apologize on behalf of the body for the abrupt recess that we underwent before the election. And just to be clear, when we were in here last week, you were asking for $7.63 million, right? And you're still here today asking for $7.63 million.
Yes, sir.
Okay, so that hasn't changed. I support giving you the $7.63 million. I want to support the working families. As I've said before, it's a worthy investment to put money into areas where the federal government is clawing back support of our grassroots working families. So, I would just say that I'm not sure what the big mystery is with the airport, but, the sooner we can get this money to you guys, the better. And so I don't really have many questions on that, but I just did want to welcome you back. And again, apologize. I feel like we could have resolved a lot of this last week, instead of recessing and, leaving you guys and the child care providers hanging. I mean, no one should be put through that. So, Sidus Masi, Mr. Chair, for the opportunity.
You're welcome. We hope this gets them paid for June.
Thank you.
Senator Jalai, you're recognized.
Thank you. So I appreciate that there's money to pay June. The invoices are in, and that's just a matter of reconciling.
Senator, there is no money to pay June. That's why I'm asking for the 7.6. 7.6 includes partial of June.
Partial?
Yes.
What? Okay, because I thought you said last week you were waiting
7.
just for the invoices to be reconciled and then they would be paid.
7.6 is for partial June, the 60 providers that we need money from, to pay.
Okay, so how much of the 7.6 is for June?
1.2.
All right, and those invoices are already in?
No, they are in our office being reconciled.
Okay.
But we need 1.2 million.
Yeah. Yeah, and I think you need the July also, so
July
that these
is coming.
daycares know that they're going to get paid and they're not, having to worry what to do right now with their staff. And they should know today whether they're going to get paid for August as well, or
Right.
because they have to plan in advance. And I think this has really been the problem. We don't have the advance planning, the advance funding, and then everybody's left in a little bit in chaos. So,
Well, we do.
yeah, I do support giving the money. I want to settle this kind of obligation that we have with these families and these daycares, their expectations so far. I just wanted to ask, so you, Ms. Davis, you said you're going to be working on updating the CCDF plan. Are there going to be changes that will impact in FY27 how much is paid or how much we need?
Thank you for your question, Senator. As of right now, any changes that the program will be implementing will rely heavily on funding. So if we were to assume that we're going to receive the same amount, program enhancement, technical assistance, and direct services for the providers will remain the same. As far as changes, besides the CCDF final ruling, that is something that we have to weigh if we need to implement, as Ms. Trish was saying, if we need to start implementing our enrollment versus attendance, or we're now going to go for attendance versus enrollment.
So you have the option to follow their rule or not?
Yes, ma'am.
All right. And so what would be the benefit of doing, gives us the pros and cons of
Sure.
each?
So currently we're paying enrollment versus attendance. So basically, whether the child attended for 15 days, 20 days out of the month, we will pay the full month's tuition of the subsidy rates. Now, if we were to switch to attendance-based, then we have what we call our child care calendars that the providers and the parents acknowledge each month, each day and month. So say, for instance, if a child attends Monday, Tuesday, Wednesday only out of the month, we will only be paying on those days. So obviously speaking, the attendance base would be a cost-saving measure too.
And what would you do with the cost savings?
If we have cost savings, of course, then we can open up to more children to be participants of the CCDF program.
All right. That would just make it harder on the agencies themselves because it's a kind of up and down amount.
Yes, yes.
All right. And then there was this document passed out, Bureau of Child Care Services, BCCCS. On one page, it talks about the state set rates. Lead agencies set maximum reimbursement rates for providers based on local market surveys or cost of care models. These rates vary significantly by state or territory and type of care and age of child and are intended to help subsidize child care costs. Will the state plan dictate these, like this market survey of the cost? Is there any potential, I guess what I'm trying to get at, is there any potential for us to like do a better study or do something else that would impact our ability to either get more funds from the federal government or else to just do this in a different way?
We can definitely do a more enhanced market study. We use an alternative methodology, which is where we gathered surveys from our providers. And so this is where we based our studies on, and a lot of it relied heavily on our technical assistance from our federal counterparts. So they basically assist us with the rates. And yes, I definitely think we can do better market studies for this.
And what would that entail?
It would entail, of course, hearing from our providers, and it would also help that our parents would be involved as well in this. We have some committees that are currently under the program. There are parent committees, the GUHNS committee, which is the Guam Early Learning Council. So these are comprised of members from different partner agencies that would have input on our studies as well.
So these studies, if they're done like in an expedited fashion, could that impact the amount of funds that we get in FY27?
So if we do a better study and we find that the market research requires us to pay more, it would still rely heavily on the funding that we'll be receiving. Because sure, if they could say that we're currently paying $700 per child and we should be paying $700 per child, if we're limited to the funds to only pay for $700, then would have to remain at the $700.
All right, but have other states used it to increase? Yeah.
Senator, I also want to express that your question about will it impact what we get in the near future, it will. And it will because any adjustment to what we're currently doing how CCDF looks at how much to give is based on the current enrollment. So that's why we kind of know that we're going to get about 22 million unless they cut it, you know, from Congress or something. And so we have to be very careful if we don't want to get anything less than 22 million that we're currently doing today. We got to be careful on dropping the numbers. Also in my discussions with, dropping the number of kids involved, because right now at 2,730, that's how the federal CCDF is looking at 22 million. That being said, in my conversation with the child care providers yesterday, my office, they, even though, you know, eligibility versus enrollment versus eligibility, their big cry is if we go by enrollment, how are they going to keep staff employed with the volatile? They don't know whether they need 10 employees today if everybody comes this week to childcare. I mean, so the attendance thing, I think they frown upon because how are they going to keep operations steady?
Yeah, but no, that's not my question. My question is, can we change the kind of the survey of the cost for Guam, like the rate for Guam, because the cost is different, so that we can, for example, that there is a higher need, like we have more, we're not covering half the children that are still eligible and would need this program, something like that. Would that, proving that, help to increase the amount that they are willing to send us?
Well, today we don't have a wait list. So
you're saying we wouldn't be able to prove any greater need?
I mean, I think there's a need. I just we don't have a wait list today.
All right. Okay.
But I'm sure, I mean,
so what is
remember we just rolled back the other folks, right? We just rolled back everyone that we expanded. So I'm not going to speak for them, but I would think if they could be a part of it again, they would be a part of it.
All right. Well, what is then the big significant variation between the states and territories? Is that just because of the number of people who are eligible, or are the rates actually different?
The rates are different because their market research may vary with ours. Like I said, if we were to, yes, we can do a new market rate research, and we have checked with our federal counterparts that we can find ways to increase our rates. But I revert again to how much we can actually pay based on our funding.
Okay.
Yeah.
Well, of course, but we could keep proving to this year, next year, that our rates should be higher and be very consistent in saying that. And that's how we get these rates to get improved, right?
Yes.
In the long run. And this is a long run game that we need to play, because we don't want to roll back childcare, right? We need to expand it if we can. And so what is the likelihood of like doing that study? You don't believe there's a downside to doing it, right?
Hi, Senator, just to add, even in our discussions with the child care providers yesterday, in comparing the amount like from Guam versus Hawaii, we just took the lower end of Hawaii at $1,100 max per child. And I just did simple calculations with the 2730, and you're looking already at $36 million. We do have a cap of the 22 right now. Now, the monies for the territories is a separate pot from the states. So it will need congressional changes.
Yes.
It will need going to our congressmen to see what can be done. But we are in that same pot with Puerto Rico and CNMI.
Okay.
So.
All right, well, I understand. But I'm just asking then that because this is a long-term thing, that we we start doing that, and we get those very concrete so that when we do go to our congressperson, we can really demand some change based on what we are able to prove for this long term. So, yeah, I think, so you're saying that even based on Hawaii's rates, we're way under. Our rates are much lower. Okay, all right. And the only thing you're thinking of updating, what is the rush to update the state plan? You said it was kind of like a big push in your conference to update the state plan, but it's only to change from enrollment versus attendance, or to consider that?
The state plan is, it's due for updating in 2027.
Okay.
So they guided all of the territories and the states to start drafting this coming fall. So that was a timeline given to us. And at the same time, any updates from the OCC, Office of Child Care, also indicated like the CCDF new rule.
All right. Thank you again. Sujasmasi, thank you all.
Thank you, Senator Tulai. Folks, we're getting close to the 12 o'clock hour, so we'll take a recess and come back at 2 o'clock. We'll see you all at 2.